First off, Kelly Linck, Legislative and Governmental Affairs Department of Human Services. There's a few people here that will help you with some more specific questions I want. Senator Teague, I want to answer, if I may, the question he has about where are we compared to national average. And I made a couple phone calls. I can't give a national average, but I can tell you we're certainly higher. In other words, our percentage is certainly higher than national averages. And that goes hand in hand with our poverty level being higher than national averages. And then, of course, when it goes to 138% of poverty, that's going to put more people on Medicaid than in other states because our poverty is higher. So it is certainly higher than national average. I could not get you specific numbers.
If you find that number, Mr. Chairman, I'd sure like to have it.
We'll continue searching for it.
How Arkansas rates at the national.
We have staff people ask that. Mr. Price can contact NCSL. Restate your question, Mr. Price.
My question was, at our, whatever percent we are at of our population that is on Medicaid, how that ranked nationally, where we were on the national, whether we were 25th right in the middle or higher or lower on that. And it's, I don't know it's worth spending a lot of capital, but if somebody finds the number, I'd like to know. Thank you.
Mr. Chair,
You can bring up whoever you want to.
I do have hopes for the Chiefs this year, by the way.
Still can make the playoffs, but
I understand.
And I'm really mad because I went to the game this weekend. It was -8 degrees at kickoff, and I had to sit all the way to the kickoff. So, who else are you bringing up?
Depending on the questions, I think that Don Staley is going to probably be able to help with much of this, being our deputy director and somewhat our Medicaid director. So Don, I'll let you join me. You want to go? I don't know if everyone has this at the desk. If you want to go over this.
They are making copies, I apologize, of the questions that we asked, but we'll go into the first one. And basically, generally, it was a question of, we were told this thing that we were going to roll back Medicaid rolls 30-35%, and these costs on traditional Medicaid back. That didn't happen. By this figure right here, if you look, we have 100 and something thousand less people on traditional Medicaid, but yet we're spending more money. And you went into attempting to answer why we are spending more money with less people on traditional Medicaid.
Right. And Don, you want to? I don't know if we might want to wait for everyone to have this in front of them and follow along, or we can just kind of read this and go over it.
Yeah, if you can, just go ahead and read it, and then they should have it out here in a few minutes. So,
Dawn Staley, DHS Deputy Director for Health and Medicaid Director. Our response is that traditional Medicaid has increased primarily due to utilization increases in the past few years. Medicaid expenditures in general are spread across 53 service categories as defined by CMS. The top 5 service categories in terms of spending in 2016 were medical group health, $933 million, nursing facilities, $693 million, rehabilitative services, just to clarify, this is non-school-based, it's $531 million, inpatient hospital services, $504 million, and prescription services, $426 million.
You might, and again, without folks being able to look at it, you might note the source of that is the financial outlook for Arkansas Medicaid, November 9, 2016. And what that is, it's the first of a series that the Department of Human Services is trying to put together at request of the governor, who said exactly how fast are we growing, are we sustainable, not sustainable, what is the outlook of Medicaid. And by May 15th of this coming 2017, through the help of former CMS director and our Medicaid advisor, Dennis Smith, who I'm hoping everyone gets a chance to visit with him one-on-one as we progress through. You'll find to be very observant of all Medicaid, and we will have a projection to the governor's office and, of course, to you on the growth. We're not disputing exactly what you're saying from the chair, Senator King. Medicaid is growing too dang fast. We don't know exactly how fast, and that's what this outlook is going to tell us. To use the word unsustainable, I think everyone uses that, and we want to put an exact number on it. Just sustainable, not sustainable, what is the number, what is our future of Medicaid in Arkansas? Again, some of your points, yeah, we hope for X amount of growth, and we're seeing growth a lot higher than that. DHS is certainly not here to dispute you on those numbers or anything else. We see it too. We're living it. We're right in the middle of it.
But, you know, it gets back to, this gets into another thing with the governor. I met with him the other day, and I told him to basically, he needs to quit misleading people that we were saving money by expanding Obamacare. That's just not true. And before the 2016 fiscal session, I was not going to vote for the appropriation bill. I said publicly, Medicaid was unsustainable, signing up too many people. There's complications and problems internally at DHS that was happening. And of course, I got attacked by the governor, and then he went out and said these things. So if you don't vote for this, you had the new DHS director saying, you know, pretty much echoing the same thing, that if we as legislators didn't vote for this, you know, and then now you guys are coming out and saying the same thing I said. I mean, the thing about this plan with the governor, it's 2 years too late.
We're not saying the exact same thing you are, Senator King, if I can. But we are saying that Medicaid is growing fast. We want to be able to tell you exactly how much and see where it's at. We're certainly not also arguing in any way with the governor or anyone's vote on anything they've done. All we're doing is we're taking a very close look at it to be able to tell you as legislators and as you're trying to write budgets where we're at on growth and where we're headed, and hopefully offer some plans for you.
No, I think the DHS director said it was unsustainable, and but I'm not arguing with you. It's more the director and the governor that are now echoing the same things that we said years ago. Let me ask you this real quick. We have 2 questions, and members, we're going to try and wrap this up by 3 o'clock since it is the holidays, and we don't make the staff mad. So, but of these increases that you mentioned in the mental health group, just give it, for some of us members, give just a very brief, I mean, nursing, we understand that one. And the mental health group, what all, just some top things that covers underneath that?
Certainly, and I realize some of the committee may be more familiar with this than others. A lot of times people talk about this as the RSPMI, the Rehabilitative Services for Persons with Mental Illness Program. And there's a lot of services in there that are for adults, children, school age, as well as adults that have what's considered severe persistent mental illness. So there's inpatient services, outpatient services, really a wide array of behavioral health services within that to help support the individuals both on a short-term basis in terms of if they're trying to work through a particular behavioral health issue, as well as those clients who are with us on a much longer-term basis who need, you know, if you will, more perhaps lifetime supports in helping manage their condition. And
basically, this is the group that the governor and others are talking about with the managed care. This particular group is what they're kind of mentioning as one of their solutions to it.
Within the discussions around both managed care as well as the provider hybrid-led model, the populations that have been discussed are those that fall within the medium and high needs tiers, both for behavioral health and then for developmental disability. So it wouldn't be everybody who is in what is called the RSPMI program today, but just those who are medium and high needs.
But most of what is, okay. Let me ask you this. You know, since our 2013 number that we went up, and yet we had less people because we removed, you know, people from AR Health Network, some of those things that did go on the private option. Did you see a substantial number of people, or what is the cost per person since 2013? That may be a question you need to get. Is what is the cost per person for somebody, and what is the number of people that went in nursing facilities or went into this mental health group?
Yes, we'd be happy to follow up after the meeting. I think as Kelly mentioned, a lot of that information is in the newly available financial outlook for Arkansas Medicaid, so we'll be happy to follow up after the committee and provide that information.
Because, I mean, as you've worked there a while, I mean, have you seen a substantial number of people go into these services in the last 3 years?
It's really been, when you look at these programs, it's a combination of both growth as in new people coming into programs, but really more so when you look at utilization. You know, in some cases it's a factor of as people age, they need more services, or as they are determined, you know, as a child, for example, you know, who may need a higher level of services. And so, you know, it really is a mixture of both an increase in new people coming into some of these programs, But even just as importantly, it's also looking at the increases in utilization. And like I said, we'd be certainly happy to follow up after the meeting and get you all some more information about cost per person and just look at how that stacks up against the enrollment within those programs.
So you're saying like in nursing facilities, nursing homes, that there's been a substantial number of people that have went into nursing homes? Or are you saying it's went up some, but yet the cost have dramatically went up? Which one, do you know?
I'm saying it's both, because nursing facilities is one where there's actually increases built into the program on a regular basis. And just as a matter of, as the state continues to age, we do see people that are in need of those services. So it is a combination of both. And rather than trying to give you all numbers that, just kind of off the top of my head today, that we definitely like to be happy to come back and give you some more details or send that as a follow-up to today's meeting.
So who goes out and checks these nursing home facilities to make sure they're accurately billing something? When you had the other coding problem that there was a problem, I mean, who goes and checks these nursing or audits these nursing home facilities to make sure they're not overcharging the people of Arkansas?
They're reviewed by a combination of different groups. Certainly for DHS, we have our Office of Long-Term Care that does the initial certification and survey of the facilities to make sure that they're able to meet health and safety type standards that are appropriate for Medicaid and Medicare. We also work closely with the Office of Medicaid Inspector General, as part of their charge is also to look at what's happening within the Medicaid program as well as from a billing perspective. And then we have a payment integrity area within DHS that is also looking at some of those things. So there's really a kind of a broad team that looks at the different components that go into nursing homes in particular.
Do they produce monthly reports that somebody, you or some of the directors sees of what they're checking up on and their findings and all that? I mean, I know like audit goes out and of course they produce reports on what they do on findings. Do they report things on findings? Because if you see, as we saw in some of the other cases of the Bureau, that all of a sudden the cost that it looks like it's possible, once we find out the people and the numbers, that cost that went up, that there hasn't been somebody checking the financials, that they're not overcharging or there's fraudulent billing?
Right, so there are a number of reports that are done on a regular basis, certainly on the certification and survey. I'll have to go back and see, what level of detail we can get on some of these other pieces. We do have, regular finance reports that we look at to see what, how much we're spending within that program and how it compares, for example, week to week or year to year. And so that is something that we do look at on a regular basis.
So you have reports over there that show that they've done these things out in the nursing facilities to make sure they're financially tracking and keeping up with what they're spending is accurate or there's integrity with it.